Did you know that over 500 million people suffer from diabetes worldwide? And around 90% of them rely on metformin as their main treatment. If you're watching this, chances are you're part of this group too. Despite being a common therapy, metformin can have serious health effects, some of which people often overlook. That's why in this video, we're going to explore some of these commonly ignored side effects of metformin, and chances are you might already be experiencing some of them. But to understand the side effects caused by metformin, we must understand what metformin is. Metformin is commonly prescribed for diabetes management, especially for type 2. It's often the first-line treatment recommended by doctors to control blood sugar levels. Even if you have pre-diabetes and lifestyle changes like exercise aren't doing enough, your doctor might suggest metformin. To regulate blood sugar, metformin operates in several ways. Firstly, it makes your body more responsive to insulin, which helps your cells use sugar from your blood for energy more effectively. Secondly, metformin decreases how much sugar your intestines absorb from the food you eat. This means less sugar gets into your bloodstream in the first place, which ultimately prevents hyperglycemia, known as the state of glucose overload. Metformin also reduces the amount of sugar your liver makes. Normally, your liver produces sugar, but metformin helps to curb this process, giving your body a much-needed break. Studies have shown that metformin can lower a blood sugar test called hemoglobin A1C by about 1%. This test gives an average of your blood sugar levels over 3 months. So for individuals managing diabetes, aiming for an A1C below 7% is the goal. And guess what? Taking metformin often helps you hit that target, keeping your diabetes in check like a pro. But just like with any medication, metformin comes with its share of side effects. If you don't pay attention to them, some of these side effects could turn into more serious issues down the road. And that's exactly why we're here today, to shed some light on these side effects. But before we dive into those lesser-known side effects of metformin, if you're finding this info helpful, make sure to hit that subscribe button for more tips on keeping your body healthy. The first problem metformin can cause is to lower your vitamin B12 levels, which may lead to anemia. Anemia can leave you feeling tired, dizzy, or lightheaded. If you're not getting enough B12 or calcium in your diet, your B12 levels might drop even further. Luckily, there are ways to boost your B12 levels, like stopping metformin or taking B12 supplements, and adding vitamin B12-rich foods to your daily meals that can help boost your vitamin B12 stores in your body. Metformin alone usually doesn't cause low blood sugar, but it can occur when combined with other diabetes medications like insulin or gliclazide. Signs of low blood sugar include feeling hungry, shaky, sweaty, confused, or having trouble concentrating. It's even possible to experience low blood sugar during sleep, leading to sweating, tiredness, and confusion upon waking. Now, if you're diabetic, low blood sugar can sneak up on you for lots of reasons. Maybe you took too much diabetes medicine, missed meals, went on a fast, didn't eat the best, or even took other medications or herbal remedies. To keep your blood sugar in check, make sure to have regular meals, especially breakfast, and don't skip them. And if you're planning to get active, grab some carbs like bread or pasta before, during, or after your workout. Always carry a quick fix carb like sugar cubes or fruit juice in case of a sugar dip. Artificial sweeteners won't do the trick. Additionally, eating a starchy carb like a sandwich or biscuit can help maintain blood sugar levels longer. This dangerous condition, known as metformin-associated lactic acidosis, or MALA, occurs due to a buildup of lactic acid, a natural chemical produced by the muscles and red blood cells. Although rare, MALA can be life-threatening, making early detection super important. Symptoms of MALA can be vague and include belly pain, feeling sick, throwing up, muscle pain, and feeling dizzy. Breathing quickly due to metabolic acidosis can be an early warning sign. In severe cases, symptoms can get worse and include low blood pressure, low body temperature, and breathing issues. Some things can up your chances of getting MALA, like having kidney or liver issues, drinking a lot of alcohol, serious heart problems, and not drinking enough fluids. MALA is often linked with new kidney issues, so problems like sepsis, heart troubles, and dehydration can trigger it. Diagnosing MALA can be tough, especially when other health problems are going on. If you're worried or having symptoms of MALA, don't wait. Get help right away. While metformin effectively stabilizes blood sugar and lowers the risk of diabetes complications, some individuals may experience a metallic taste in their mouth when taking this medication. The exact reason for this taste disturbance isn't fully understood, but it's likely related to the drug being secreted into saliva. The good news is that this metallic taste issue is usually temporary, and the taste sensation typically returns to normal within 1 or 2 weeks. So if you're experiencing this side effect, there's a good chance it will improve on its own over time. While researchers haven't nailed down exactly why metformin often causes tummy troubles, they have some ideas. Studies suggest it might rev up glucose absorption in the gut, mess with the balance of bacteria in your gut, and shake things up in the gut-brain-liver connection. These actions help your gut handle glucose better, which is great for diabetes, but they can also stir up issues like diarrhea, nausea, tummy aches, and vomiting. If you're dealing with these problems, it's important to find ways to ease them, especially diarrhea, which can be a big deal. Staying hydrated is super critical, especially for folks with diabetes. Dehydration from diarrhea or vomiting can mess with your glucose levels and be risky. So drink lots of water and think about sipping on drinks that help replace electrolytes. For men with type 2 diabetes, erectile dysfunction, or ED, can be a tough complication. Diabetes can harm the blood vessels and nerves involved in getting an erection. Men with diabetes are 3 times more likely to have ED compared to those without diabetes, says the CDC. Adding to the challenge, metformin can sometimes worsen ED for some men. Starting metformin might actually help ED for some guys because it can improve blood flow by raising nitric oxide levels. But it's not always a win. Diabetes treatment might not fix ED completely, and studies show metformin can lower testosterone levels, which can mess with sex drive and cause ED. It slows down a key enzyme that helps make testosterone, leading to lower levels of this hormone. If you're struggling with ED and metformin is your main diabetes medicine, don't stress. There are separate treatments for ED, so it's a good idea to talk to a urologist for options. Plus, there are other diabetes meds like sulfonylureas that might not mess with your testosterone levels as much, so it's worth discussing alternatives with your doctor. They can help you find the right approach to manage both your diabetes and ED effectively. Unlike diarrhea, constipation isn't a common issue with metformin, but it can happen, particularly with long-term use. Keep in mind that it could also signal low vitamin B12 levels, which can be linked to metformin usage over time. If you're dealing with constipation while on metformin, don't worry too much. It often improves as your body adjusts. To help things along, try drinking plenty of water, loading up on fiber-rich foods, and incorporating gentle exercises like walking into your routine. However, if constipation doesn't go away or becomes bothersome, it's smart to consider using a laxative or exploring other treatment options. Your doctor can also run a blood test to check your vitamin B12 levels if constipation persists despite trying different remedies. This can help identify any underlying issues causing the problem. Like many medications, metformin can trigger allergic reactions in some individuals, although it's unclear if this occurred during clinical trials. Symptoms of an allergic reaction can vary in severity and may include a skin rash, itching, flushing, swelling under the skin, especially around the eyelids, lips, hands, or feet, and swelling of the mouth, tongue, or throat, which can make breathing difficult. If you're dealing with mild allergic reaction symptoms, it's a good idea to reach out for help, but if things get serious and you're feeling like it's an emergency, don't wait. Just dial your local emergency number for immediate assistance. And if you want to know more information about managing allergies at home, check out this video, How to Treat Histamine Intolerance with a Few Simple Steps.